Face reading. Chronic hepatitis. Chronic hepatitis is a chronic inflammatory disease of the liver caused by many factors, and the course of the disease lasts generally more than 6 months. Most of the hepatitis you will hear discussed refers to viral hepatitis caused by two types of hepatitis viruses, A and B. Common symptoms are fatigue and stomach discomfort, which are easily overlooked. The manifestations are primarily extreme fatigue, nausea, vomiting, abdominal bloating, jaundice, and loss of appetite. Some patients have a scleral or skin infections. The pathogen is often related to factors such as viral infection, decreased autoimmunity, the influence of drugs and alcohol, and abnormal metabolism. When the white of the eyes are yellow, it suggests jaundice hepatitis. When the iris is deformed and appears dark brown, it suggests chronic hepatitis. As seen here in the figure, the whites of the eyes are yellow and the iris are deformed and appears dark brown. Therapeutic methods. Patients with chronic hepatitis should be quarantined, stop drinking alcohol, and quit smoking to protect the liver. Periodic rest should be incorporated to work to avoid excessive fatigue. The dietary advice would be to eat foods high in protein and vitamins and avoid excessive intake of carbohydrates to prevent fatty liver. All alcoholic beverages are to be strictly eliminated. Exercise. Work and rest should be properly balanced. After the liver function improves, you can do some exercise, such as walking. Appropriate amounts of exercise are conducive to physical recovery. Emotional adjustment. If patients with chronic hepatitis feel depressed, their condition will worsen. It is imperative to maintain a good mood so the liver can be nourished and protected, which is ultimately conducive to recovery. As seen here, we can massage the liver zone on the hands. Massaging the liver zone on the hands, stimulating the liver. This will improve the symptoms of chronic hepatitis. Bend the index finger and press the liver zone for 3 to 5 minutes once a day. Thank you for your attention.
Interviewing amount of menstrual bleeding, we have a case history of a 49-year-old woman who had been suffering from menstrual flooding for 11 years. Since the birth of her second child when she was 35, her cycle had been irregular, varying in length between 17 and 45 days. The period lasted 7 days in total and was painful. The menstrual blood had clots and she had a brown discharge for 1 day after the period. Her periods also had been painful in the years following menarche at 12. Her gynecological history was rather complicated as she had been on the contraceptive pill from the age of 18 to 30. She had a miscarriage at 30, the first child at 31, another miscarriage at 34, and a second child at 35, and the periods became very heavy at 38. In complicated history such as this one, it is helpful to draw two diagrams, one outlining the main gynecological events of her life and the other depicting the menstrual cycle. So apart from the gynecological problem, she has had difficulty in bladder and bowel control since the second pregnancy. Her pulse was slightly overflowing and rapid and very weak on both rear positions. Her tongue was red and slightly purple. So here we have the organs influencing the areas of the breast. So we have the liver and gallbladder, the stomach, and we have the penetrating vessel. The menstrual flooding is caused by blood heat, which is evidenced by the red tongue and overflowing rapid pulse. There is also some blood stasis indicated by the painful period, menstrual clots, irregular cycle, and slightly purple tongue. There is also an underlying kidney deficiency, which is indicated by the weakness of the pulse in both rear positions and by the fact that the menstrual flooding started after the second childbirth, and she had 2 miscarriages. The treatment principle is therefore to cool blood, stop bleeding, invigorate blood, and tonify the kidneys. In gynecological problems, it is often appropriate to apply different treatment principles in each phase of the menstrual cycle. There are 4 phases in the menstrual cycle, the first being the period itself, during which blood is moving, the second being the postmenstrual phase, during which there is a relative blood deficiency. The third being ovulation, during which the penetrating and directing vessels are active, and the fourth being the premenstrual phase, during which liver chi moves. In this case, we can therefore cool and invigorate blood during the premenstrual phase and the period itself, and tonify the kidneys after the period for about 2 weeks. Thank you for your attention.
Let's discuss the hand-tie-in lung meridian, Sha Bai, or Valiant White, or lung 4. Lung 4, or Sha Bai, is located on the anterolateral aspect of the arm, just lateral to the border of the biceps brachii muscle, fortune inferior to the anterior axillary fold. Sha Bai is a point with less specific intent than the previous 3, but still mostly used for the mind and spirit. It is a quintessential metal point. Sha, meaning valiant, protecting, guarding the lung, is a canopy, like a protective roof above the other Zhanghu. Bai is white, the color associated with metal, and with the sunset and the descending movement of the pole. The pole governed perception and instinctive movement. Valiant White can be used to potentiate and strengthen the qualities of justice, conviction, and equilibrium, which can be seen as aspects of metal together with the abilities to gather in and set limits appropriate to autumn, the season of the lung. Lung 4 can be used alone or to amplify and ground the effects of any of the first 3 points on the lung meridian, reinforcing them with the strength, stability, and vitality of the lung in good health. It is a good point for cleansing and resilience. Lung 4 regulates chi and blood and relieves pain. Its indications are for mental clarity and courage, for anxiety accompanied by palpitations, for chest pain and shortness of breath, and it disperses the sensation of fullness in the chest. It is also indicated for pain in the medial aspect of the arm. Lung 4 helps reinforce mental clarity, sometimes used as an adjunct to lung 1, 2, or 3 when treating the spirit. White is the color resonant with metal, and valiant may refer to the protective nature of lung's canopy. Consider this point for pain in the arm, fullness in the chest, or shortness of breath. Thank you for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine, Menorrhagia and Metrorrhagia. Menorrhagia is a medical term that refers to excessive blood loss during a menstrual cycle that is accompanied by severe cramps, while the Metrorrhagia is a medical issue that causes irregular bleeding, mainly between 2 menstrual cycles. Menorrhagia indicates heavy prolonged periods, while the Metrorrhagia indicates bleeding outside the normal menstrual period. Number 1 organic causes, letter A, cervical cancer, postcoital, postmenopausal or intermenstrual bleeding, blood-stained vaginal discharge. Letter B, endometriosis, increasingly painful heavy periods and cramps, clotted blood, lower backache, painful sexual intercourse, painful bowel movements, premenstrual spotting, infertility. Letter C, uterine cancer, normally post-menopause with gradually increasing bleeding. In premenopausal women, irregular or intermenstrual bleeding, discharge is rare. Letter D, uterine fibroids, affects 20% of women by age 40 years. Heavy bleeding with clots, cramps, pain, intermenstrual bleeding, unusual, sensation of fullness in the lower abdomen, frequent urination, sudden severe pain if fibroid twist or degenerates, rarely malignant. Number 2, functional causes. Letter A, pregnancy complications, miscarriage, heavy clotted vaginal bleeding, lower backache, abdominal pain. Second, ectopic pregnancy, abnormal vaginal bleeding, lower abdominal pelvic pain, breast tenderness, nausea, low backache. If hemorrhaging occurs, there is sharp, sudden pain in the lower abdomen, dizziness, referred pain to the shoulder. Letter B, as menopause approaches, periods may be increasingly frequent, heavy, caused by hormonal imbalance. Number 3, other causes include abnormal thyroid, pituitary function, changes in birth control pills, use of IUD for birth control, pelvic inflammatory disease, trauma, certain drugs, steroids, blood thinners. Chinese differentiation, Menorrhagia and Metrorrhagia, diagnostic questioning according to, first, the nature of bleeding and pain, heavy, thick, deep red, purple blood, strong odor, lower abdominal pain, irregular flow, blood heat, early red or purple blood, profuse or scanty, possible clots, starts and stops slowly, irregular flow, abdominal hypochondrial pain, stagnation of liver qi turning to heat, early moderate or profuse bleeding, phlegm heat, early following profuse vaginal discharge or dark red purplish discharge, may be foul-smelling, chronic abdominal pain, worst towards period, damp heat. Early scanty purplish blood with dark clots, pain, relief after passing clots, regular lingering flow, liver blood stasis. Early profuse lingering watery light red blood, no pain or chilly pain, better for pressure, qi, and yang deficiency. Early scanty, sticky, thick, painless lingering blood, empty heat. Excess bleeding after sex during menstruation, chong and red dysfunction. Number 2, etiology, hot environment or excess hot, spicy, greasy food, full heat. Depression, that is stagnation of liver qi turning into heat. Worry, anxiety, lack of exercise, excess sweet, cold, raw food, spleen qi deficiency causing damp or phlegm heat. Overwork, kidney essence weakness, yin deficiency. Number 3, Sangfu patterns. For the excess, there is blood heat, liver qi stagnation turning into heat, phlegm heat, damp heat in the lower burner, liver blood stasis. For the deficiencies, spleen qi deficiency, kidney yang deficiency, kidney yin deficiency, chong and ren disharmony. Thank you for your attention.
Let us now discuss qi. The topic is thoracic qi, nutritive qi, and defensive qi. Thoracic qi. Let us look at the formation and its distribution. Thoracic qi is a mixture of fresh air inhaled by the lung and essential qi transformed by the spleen and stomach from the essence of drink and food. Following formation, it accumulates in the chest. Hence, the chest is called the upper sea of qi. After being acted upon by the lung, it moves up to the throat and sideways into the heart meridian. After being acted upon by the lung, it moves to and is stored in dantian, which is located in the pelvic abdomen about 1.5 inches below the umbilicus. Dantian is the starting point of the ren, du, and chong meridians, and the confluence of the entire body's qi. Hence, it is also known as the lower sea of qi. From dantian, it further enters via the acupoint, stomach 30, the stomach meridian of foot yang ming, and into the feet. The abundance or deficiency of thoracic qi directly affects the functions of the lung, the spleen, and the stomach. Now let's look at its physiological actions. Thoracic qi has 2 main actions. One is to facilitate respiration by coursing through the respiratory tract. This also relates to the strength of the voice and of speech. The another is to course through the heart meridian to energize the beating of the heart and regulate the heart rate and rhythm. In clinical practice, the physician generally assesses the ampleness of thoracic chi by palpating the pulse of the apex of the heart, just below the left nipple. Now let us look at nutritive chi. Nutritive chi is that chi which flows with blood in the vessels. It is closely related to blood. Indeed, though conceptually they can be distinguished, they are inseparable in reality. Hence, they are often referred to as nutritive blood. Because it belongs to yin, it is also called nutritive yin. In some respects, nutritive chi stands in opposition to defensive chi. Its formation and distribution. Nutritive chi derives mainly from essential chi that is transformed from food and drink by the spleen and stomach. It resides in the blood vessels and is an important component of blood, and it circulates throughout the body via the meridians. Its physiological actions is, aside from becoming a component of blood, the principal function of nutritive chi is to nourish the body. It supplies the nutrients necessary for the Zangfu viscera, the meridians and other organs and tissues to function normally. Now let's look at defensive chi. Unlike nutritive chi, defensive chi flows outside the vessels. Because it belongs to yang, it is also known as defensive yang. Thus, it stands in opposition to nutritive chi. Let us look at its formation and distribution. Like nutritive chi, defensive chi also derives mainly from essential chi that is transformed from food and drink by the spleen and stomach. Innate chi in the kidney plays an activating role in its formation. Defensive chi is characterized by vigor, smooth and fast flow, and great power. It is not confined to the vessels but flows throughout the body, especially the skin and the flesh. It is conveyed upward by the spleen and dispersed by the lung. The physiological actions of defensive chi has three actions. 1. It guards the body surface against attack by exogenous pathogenic evils. 2. It warms and nourishes the Zangfu viscera, muscles, skin and hair, and other tissues. 3. It controls the opening and closing of the orifices and pores and the excretion of sweat, thereby maintaining a stable body temperature. Let's look at the comparison with nutritive chi. Both nutritive chi and defensive chi derive mainly from essential chi that is transformed from food and drink by the spleen and stomach. However, nutritive chi courses in the vessels, whereas defensive chi courses outside them. Nutritive chi is yin, whereas defensive chi is yang. It is only when these two work together harmoniously that they can both act normally. Now let us look at the comparison of genuine chi, thoracic chi, nutritive chi, and defensive chi. For genuine chi, the common point is food essence as a respective composition. The formation is derived from innate chi and supplemented by acquired chi. The distribution is throughout the body by sanjiao. Its action is it promotes growth and development and stimulates functions of Zangfu viscera and meridians. And its feature is the primary motive force for vital activities. For thoracic chi, it's the same as genuine chi. It is the food essence as a respective composition. Its formation is combination of essence from food and fresh air. The distribution is upward to the throat, running through the heart and lung, going down to the dantian, pouring into the stomach meridian. Its action is promotes lung respiration, energizes the heartbeat, and regulates heart rate and rhythm. Its feature is its states can be assessed by the pulsation of the apex of the heart. For nutritive chi, the common point is derived from essence of drink and food. Its formation is derived from essential chi of food and drink. Its distribution it circulates within blood vessels, and its action is it nourishes the whole body, and the feature is cream and softness. For defensive chi, just like nutritive chi, is derived from essence of drink and food. It's also derived from essential chi of food and drink. Its distribution is circulates outside blood vessels. Its action is it protects and warms body and maintains body temperature. Its feature is a vigorous, smooth, strong with a rapid flow. Thank you so much for your attention. Let us now discuss diagnosis according to Zangfu organ patterns. The topic is kidney yin deficiency and liver yin deficiency. Kidney yin and liver yin have a common root, which means that a deficiency condition in one can easily lead to a deficiency condition in the other. Kidney and liver yin deficiency can result from aging, mental and physical overexertion, chronic illness, too little sleep, emotional stress and problems, frustrations and pent-up emotions, too much sex, too much coffee, dietary factors and medicines that are warming or spreading in their energy, long-term blood deficiency or heat conditions, and chronic yin deficiency conditions in other organs. The symptoms and signs are dry eyes, blurred vision, night blindness, nagging headache, dizziness, insomnia, night sweats, numbness or tingling in the limbs, leg cramps in the evening and at night, thin body, poor hearing, dry mouth and throat, dry mucous membranes, dry hair and skin, dry stools, sparse or absent menstrual bleeding, infertility, thin tongue with a lack of coating, and possibly cracks in the surface of the tongue. The pulse will be fine or empty, and the pulse may be relatively weak in the left chi and guan positions. If liver and kidney insufficiency have resulted in deficient heat, there can also be hot flushes, heat in the evening and at night, a hot sensation in the palms of the hands, soles of the feet, and the center of the chest, a thirst with a desire to drink in small sips, a red and dry tongue that lacks coating and possibly with cracks in the surface. The pulse will be fine and rapid and possibly a superficial pulse. The key symptoms are dry eyes and throat, insomnia, night sweats, lack of tongue coating, being warm in the evening or hot at night, and if there is deficient heat, there can be hot flushes. The treatment principle is to nourish the kidney and liver yin, and possibly control deficient heat. The acupuncture points to choose from is kidney 3, kidney 6, kidney 13, spleen 6, liver 3, inserted through to kidney 1, and liver 8, ren 4, UB18, UB23, and UB52. The needling technique is tonifying. The explanation for the points used are kidney 1, kidney 3, kidney 6, kidney 13, ren 4, UB23, and UB52 nourish kidney yin. Spleen 6 nourishes kidney and liver yin. And liver 3 and UB18 nourish liver yin. Kidney yin deficiency and liver yin deficiency can be caused by kidney yin deficiency and liver blood deficiency, which can result in yin deficiency heat, ascending liver yang, and kidney yang deficiency. Thank you so much for your attention.
Disturbance of qi, qi deficiency. Disturbance of qi and blood include their insufficiency, impairment of physiological actions, and disruption of their mutual dependence and interaction. As in the case of rise and fall of genuine qi and evil qi, or imbalance of yin-yang, disturbance of qi and blood is not only the underlying mechanism of certain illnesses, but also the basis for clinical analysis. This group includes disturbance of qi, disturbance of blood, and disharmony of qi and blood. Disturbance of qi. This includes mainly the following two aspects. The first is deficient qi caused by insufficient production or overconsumption of qi. The second is subnormality in certain actions of qi and abnormal or chaotic flow of qi, from which follow such abnormalities as stagnation of qi, counterflow of qi, sinking of qi, blockage of qi, or collapse of qi. Let's talk about deficiency of qi. This is the pathological state in which primordial qi is impaired, so that the functions of the viscera and meridians become weakened and resistance to illness lowered. The most common of this condition are inadequacy of innate endowment, postnatal malnutrition, excessive fatigue and exhaustion, chronic illness, and reduced function of the spleen, the lung, and the kidney. All these lead to insufficient generation of qi, and because of the intimate relationship between qi and blood and between qi and body fluids, any deficiency of qi will affect blood and fluids. The result is inadequate generation of blood and fluids, their circulation, or their loss. Clinically, qi deficiency is manifested by weakness in protecting against external agents, with a tendency to perspire, susceptibility to illness due to lack of defensive qi, atrophy and weakness of the four limbs, lack of nourishment, and dispiritedness and vertigo due to failure of clear yang to ascend. Thank you for your attention.
Let's now discuss enuresis and incontinence with the patterns heart fire and damp feet in the bladder. First, let's talk about heart fire. Its clinical manifestations, there will be nocturnal enuresis lasting into later years, nervous child, palpitations, thirst, insomnia, and crying at night. The tongue will be red with a redder tip and with red points, thick yellow coating. The pulse will be overflowing on left front position. This pattern may be combined with a kidney deficiency. Such a combination is often seen in children's nocturnal enuresis. The treatment principle, drain heart fire and calm the mind. For the acupuncture points, we can use heart 8, REN 14, spleen 6, and kidney 3. And use the even method. Heart 8 and REN 14 drain heart fires, spleen 6 and kidney 3 tonify the kidneys. Now let's go to damp heat in the bladder. Its clinical manifestations, there will be nocturnal enuresis or incontinence, difficult urination, burning on urination. The tongue will have a sticky yellow coating and the pulse is slippery. Treatment principle, clear heat and resolve dampness, promote the bladder's chi transformation. The points to use are spleen 9, spleen 6, REN 9, stomach 28, bladder 22, REN 3, bladder 28, and bladder 32. For the needling technique, we use the even method. Spleen 9, spleen 6, REN 9, and stomach 28 and bladder 22 resolve dampness. REN 3, bladder 28, and bladder 32 promote the bladder's chi transformation and open the urinary passages. For the prognosis, acupuncture and herbs can give good results in treatment of enuresis and incontinence. As for enuresis in children, if the child is under 10, a brief course of acupuncture may sometimes suffice to produce a cure. If the child is over 10, enuresis is more difficult to treat. Of the two types of enuresis, the deficiency type is easier to treat than the excess one from liver fire. As for incontinence, it usually responds to treatment with acupuncture and herbs in a few months, unless it is due to a neurological disease such as multiple sclerosis, in which case it may not respond to treatment at all, or may respond only very slowly. For blood in the urine, it is characterized by the presence of frank or occult blood in the urine, usually without pain. If it is accompanied by pain and difficulty in urination, it falls under the category of urinary syndrome. If there are large amounts of blood in the urine will be smoky colored, bright red or reddish brown, and this condition is termed gross hematuria. When blood is not visible to the patient and is discovered accidentally during routine tests, this condition is called microhematuria. Hematuria may be caused by various different diseases such as nephritis, endocarditis, polyarteritis, systemic lupus erythematosus, if it affects the kidneys, TB of the kidneys, polycystic disease, hemorrhagic disease, tumor of the kidney, infection of the lower urinary tract, and carcinoma of the prostate or bladder. When blood is present in the urine, a cause should always be sought and found in Western medicine. It is therefore essential to get a proper Western diagnosis from a urologist. It is convenient to classify hematuria into pre-renal, renal, and post-renal, depending on whether the cause resides in organs above the kidney, in the kidney itself, or in organs below the kidney, that is bladder and or prostate. Timing of blood in the urine stream provides another clinical, though non-specific classification to localize the source of bleeding. When blood appears only at the beginning of micturition, the source of bleeding is below the bladder. When blood is uniformly mixed with urine, it may come from anywhere above the urethra. Here is an illustration of the causes of blood in the urine in Western medicine. It's pre-renal or above the kidneys. It may be due to endocarditis, or due to drugs like warfarin. If it's renal, it may be due to glomerulonephritis, pyelonephritis, carcinoma of the kidneys. It's post-renal, it could be due to cystitis, carcinoma of the bladder, or prostatitis. A red flag in Western medicine is the progression of, in case of progressive incontinence of recent onset. Neurological disorders must be excluded, such as normal pressure, hydrocephalus, usually associated with dementia and gait disturbance, multiple sclerosis, Parkinson's disease, and amyotrophic lateral sclerosis. Thank you for your attention.